We welcome our next presenter, Dr. Mo Donald. This is going to be a great resource that she'll be able to share. She is a researcher with the Division of Nephrology at the University of Calgary. She completed her PhD in health sciences and has been a physical therapist since 1992. Dr. Donald is passionate about interventions that support person-centered care and innovations that address the evidence practice gap for patients with chronic kidney disease. Her current work involves understanding the needs of individuals with early-stage chronic kidney disease and investigating optimal strategies for supporting them and their families. So I turn it over to you, Mo, and please let me know if you need us to share the screen for you.
Sure. I'll try running the slides, but I'm hoping my Wi-Fi will hang in there.
Excellent. Thank you.
Okay, just hang on tight, everybody. I'm just going to load up the presentation here. It's not letting me load it. The screen, I can share it, but it won't let me load the presentation.
We will take care of that right now.
Perfect. Thank you.
Thank you.
It might be the size. Yeah. Thank you, Flavia. Perfect. Great. Thank you so much. And thank you for that introduction. And thank you for welcoming me to present tonight at the Patient Forum. So I'm going to discuss over the next few minutes and show you some videos around My Kidneys, My Health website, which has been developed by patients for patients. And this work has been supported by the CanSolve CKD network. And also it's a partnership where we have patient researchers or patient partners as researchers, clinicians, and policymakers working together to transform care for chronic kidney disease. Next slide, please. So I'm going to start off with this story. It won't be as great as some of the stories shared earlier tonight, but this is my dad, Nathan, and it's interesting. I started work. I left my classic research orthopedics as a physio and moved into the world of kidney disease. And within a year, that was about 6 or so years ago, and within a year of transferring into kidney research, my dad, Nathan here, with his best friend, Megan, developed chronic kidney disease. And he is now 87 years old and basically is around an EGFR of about 26. We just found out this last week when he visited his kidney doctor. But basically, I have a personal story that kidney disease is in the family. And it was kind of serendipitous that I work in this area. And I'm really interested in the stories and patient experiences that lead this work. So you'll see this through my presentation. Next slide, please. So that one thing I mentioned is this work is supported by CanSolve CKD network, which is a patient-oriented research support system. And the research that I've been involved in over the last 6 years is supported and decisions are made by our patient partners. So these patient partners are equal partners on our research team and have worked through the last 6 years with me. Next slide, please. So these are some of the faces of the patient partners that I work with. And you can see I have Blair up there in the far left corner, and he's in Manitoba. And then we have representation from the far east coast, from Dwight in Newfoundland, and then others in British Columbia and here in Alberta. Next slide. So I want to take a step back to how we got to this website. So I'm going to give you a brief background around how this came to be. Next slide. So this project was done in multiple phases. And so we started with phase 1, where we wanted to know what type of resources are out there in the literature and what's the evidence around them in terms of supporting patients with chronic kidney disease to self-manage. We also wanted to understand what is happening on the ground in Canada in terms of supporting patients with CKD. And an example of that is the Kidney Foundation and clinics within your local areas across Canada that support CKD self-management. So we looked at the literature and we asked clinics across Canada to tell us what they do to support patients and caregivers with CKD. Then we led to phase 2, where we wanted to hear from patients and caregivers across Canada. So we did focus groups and interviews and wanted to understand what their experiences have been with self-management support for CKD. And we completed the focus groups and interviews, and I'll show you a slide in a second of what we found out. And then the third phase was then we wanted to fill the gaps that exist. Specifically, what we heard was around early stage CKD support. So in terms of the great work that we heard today with Tracy, this nicely ties in, this website I'm going to show you ties nicely in with the Kidney Foundation and helps patients fill those gaps that are experiencing early CKD. And finally, I'll talk quickly about our dissemination and implementation of this website. Next slide, please. So one of the things that we heard, and this picture demonstrates, is, and this was designed by our patients, both the patient participants in the focus groups and interviews and our patient partners, that they said that living with chronic kidney disease is like a roller coaster. And that they said that if I only knew now what I should have known then, would have been helpful in the early stages of CKD. And so, as we heard earlier, some of the topics that Tracy mentioned in terms of social work support, and also Stephanie mentioned in terms of physical wellness, you can see that there's this individual at the top of the roller coaster. That's basically the key messaging is living well with CKD. But then these little parts of the roller coaster demonstrate the topic areas that patients and caregivers were interested in having more information on, or more so related to early stages. And then you can see the supports of the roller coaster are tangible, practical support systems and CKD information sharing. And the people in the background, there are those contextual supports that they said, that their community supports them, their peers support them, their family support them, the healthcare professionals support them to manage this roller coaster journey. Next slide, please. So here is My Kidneys, My Health website. And as you can see, it's scrolling through this homepage of those topics you saw on the roller coaster and some of the information and topics that Tracy brought up earlier. And basically, this website was named, we had a naming competition that was held across Canada. And this name, My Kidneys, My Health, was presented by one of the patients that saw the call for naming it. And again, I want to highlight this fits nicely with the Kidney Foundation website and information, but really is around more of the early stage CKD. So being diagnosed, you're sitting in the community setting where most of your care is managed by primary care, and individuals might go to see their nephrologists once a year or every 6 months. So one thing about this website, when we designed it, as I mentioned, as the title said, is designed for patients by patients, is that we used evidence that was in the literature, expert input from people like someone like Tracy, social workers across Canada, pharmacists across Canada, dietitians across Canada, and patients, obviously. And we follow all the criteria for accessibility in terms of vision, hearing, and also around the health code for health information. Next slide, please. So now I want to, because I can't tell the story as well as one of our patient partners, Dwight. So this video will play for about just around 5 minutes, and I want Dwight to tell his experience with building this site.
Hi, my name is Dwight Sparks, and I was diagnosed with chronic kidney disease in 2014. That year, I was also diagnosed with systemic vasculitis. So I've been living with this disease now for about 7 years. I joined CanSolve in 2017. I was given a list of projects that I could pick from, and the self-management project instantly jumped out. I have stage 3 kidney disease, and it just seemed like a natural fit. The other projects involved dialysis, transplant. I didn't know very much about that, but self-management, well, that was something that I could really, that I knew something about. So I was really excited to join the project. My Kidneys, My Health is what I consider one-stop shopping for living well with kidney disease. It's a comprehensive self-management tool designed by patients for patients. From my lived experience, I found when I was diagnosed in 2014, my nephrologist said, Dwight, cut out your salt, and basically set me on my way. And there's a lot more to it to successfully manage your disease. And a lot of I found as I began my research that a lot of the websites out there was very one-dimensional, that it only dealt with a particular, like one aspect, say diet, of managing your disease. But My Kidneys, My Health touches on all the aspects. There's basic info on the disease itself, how the kidneys work, food and diet, always so important, medication, symptoms, mental and physical well-being, finances, work and school, and travel. So it just touches on so much that the disease affects. I really wish that My Kidneys, My Health existed back in 2014 when I was first diagnosed. So this saved me a lot of time, a lot of frustration, trying to gather the information that you need to successfully manage CKD. I love the site just because there's so much to it. But so many good features. But if I had to pick one, or I say two, it would be the food and diet. Being able to select the food list, select foods from the food list, and be able to see, like in a serving, like how much potassium, how much phosphorus, how much salt is in. That's for me the biggest challenge day to day, is trying to manage my diet. I also like the questions list, because oftentimes you're reading through stuff and something will kind of spark a question that you want to ask your doctor. And with this website, now you have the ability to, if something pops in your head, you can write it down and then print that off that question list and bring that to your nephrologist the next time that you meet. So again, like, so many great features, but those are the two that really stand out for me. Well, I guess where we are now, and we can see we produced this great site, and it's just I'm just so happy and so pleased to be a part of the team. It's been four long years of a lot of phone calls, meetings. A big shout out to the The research team, they really went out of their way to include patients on every step of the development of the website. It was such like a great environment to be a part of.
Next slide, please. So that was a quick overview of some of the interactive features of the website. Next slide, please. And I just wanted to highlight a few other ones. So yes, you can see here, if you go to the website and click on medications, next slide, you get these kind of cards that you see there, 3 types of cards, and those topics and the information behind each of those cards all reflect what patients wanted to read about, but how they wanted to be able to filter through the information and the visuals they needed. So I recommend go and play on the website. Next slide, please. And then this ties nicely into the work that Tracy supports, the mental well-being component. What we heard was the concern both from patients and caregivers around understanding their mental health or evaluating if they should have concerns of seeking out help. So next slide, there's the mental health tab, and it has information that's pretty general there. Next slide. But also the patients and caregivers asked us to put a screening tool up there. So next slide. And here's just a visual of a quick 2-question validated mental health screener. I should highlight that all the information, for example, for the mental well-being is there, but it directs you to the Kidney Foundation for further details. So some of the information that Tracy brought up is this leads you to that information. Next slide. I have one really short video. I wanted to just describe another feature. So what we heard was we wanted to be culturally sensitive, accessibility in terms of hearing, reading, and also people wanted snippets. They said when you're first diagnosed with kidney disease, it's a shock. And they said, you know, maybe I just want to watch a 30-second video. I don't want to read a lot of stuff. I don't want to take home a big book. I just want to get a feel for some of those topics. So I'll let you play this one, so please. And this is on symptoms.
What are the potential symptoms of chronic kidney disease? Most people with higher kidney function do not have symptoms related to chronic kidney disease. Your kidneys can work well enough, even when kidney damage is present. Chronic kidney disease is silent. As your chronic kidney disease worsens, you may experience the following symptoms: poor appetite, loss of concentration, itchy skin, where the itch feels bone deep, low energy levels, and lack of interest in everyday activities. For example, you may feel unusually tired after routine activities, such as taking a shower or grocery shopping. These symptoms will vary by the level of your kidney function and can be different for everyone. If you have ongoing symptoms, talk to your healthcare professional for suggestions and treatments. To learn more about symptoms and living well with chronic kidney disease, explore our website.
So next slide, please. And so where we're at is this website is open access. So you can go to My Kidneys, My Health and view the website and play around with it. We've been fortunate to start disseminating this in March, and World Kidney Days and events like this are great. So passing around the messaging and just keep clicking there. Thank you. And so these are just some of the social media events that have been taken place. And next slide, please. So I just want to wrap up and acknowledge all the people that are involved in this work and the research team and the Kidney Foundation. Next slide, please. So I've ended with this. Some mornings I wake up and this is what's on my plate. My husband believes in making kidney pancakes for me to get me revved up in the morning, off to work.